Syphilis. What to know? Syphilis is a sexually transmitted bacterial infection. It is treatable in the early stages, but without treatment, it can lead to disability, neurological disorders, and even death. In 2018, the Centers for Disease Control and Prevention noted that 64% of syphilis presentations involved men who have sex with men. However, the number of cases in heterosexual men and women is also increasing. Syphilis is treatable with antibiotics, especially in the early stages. It does not resolve without treatment. What is syphilis? Syphilis is an infection that develops due to T. pallidum bacteria. This bacteria can spread between people through direct contact with a syphilitic sore. This sores may develop on the skin or mucous membranes of the vagina, anus, rectum, lips, or mouth. Syphilis is most likely to spread during oral, anal, or vaginal sexual activity. People rarely pass the bacteria on through kissing. The first sign is a painless sore on either the genitals, rectum, mouth, or another part of the skin. Some people do not notice the sore as it does not cause pain. These sores resolve on their own. However, if a person does not receive treatment, the bacteria remain in the body. They can remain dormant in the body for decades before reactivating and damaging organs, including the brain. Symptoms. Doctors categorize the stage of syphilis as either primary, secondary, latent, or tertiary. A variety of symptoms define each stage. The disease can be contagious during the primary and secondary stages and occasionally the early latent phase. Tertiary syphilis is not contagious, but it has the most severe symptoms. Primary symptoms. The symptoms of primary syphilis include one or more painless, firm, and round syphilitic sores or chancres. This appear 10 days to 3 months after the bacteria enter the body. Chancres resolve within 2 to 6 weeks. However, without treatment, the disease may remain in the body and progress to the next phase. Secondary symptoms. Secondary syphilis symptoms include sores that resemble oral, anal, and genital warts, a non-itchy, rough, red or red-brown rash that starts on the trunk and spreads to the entire body, including the palms and soles. Muscle aches, fever, a sore throat, swollen lymph nodes, patchy hair loss, headaches, unexplained weight loss, fatigue. These symptoms may resolve a few weeks after they first appear. They might also return several times over a longer period. Without treatment, secondary syphilis can progress to the latent and tertiary stages. Latent syphilis. The latent phase can last for several years. During this time, the body will shelter the disease without symptoms. However, the T. pallidum bacteria remain dormant in the body, and there is always a risk of recurrence. Doctors still recommend treating syphilis at this stage, even if symptoms do not occur. After the latent phase, tertiary syphilis may develop. Tertiary syphilis or late syphilis. Tertiary syphilis can occur 10 to 30 years after the onset of the infection, usually after a period of latency during which there are no symptoms. At this stage, syphilis damages the following organs and systems: heart, blood vessels, liver, bones, joints. Gomas may also develop. These are soft tissue swellings that can occur anywhere on the body. Organ damage means that tertiary syphilis can often lead to death. Treating syphilis before it reaches this stage is therefore critical. Neurosyphilis. Neurosyphilis is a condition that develops when T. pallidum bacteria have spread to the nervous system. It often has links to latent and tertiary syphilis. However, it can occur at any time after the primary stage. A person with neurosyphilis may be asymptomatic for a long time. Alternatively, symptoms might develop gradually. Symptoms include dementia or altered mental status, abnormal gait, numbness in the extremities, problems with concentration, confusion, headache or seizures, vision problems or vision loss, weakness. Congenital syphilis. Congenital syphilis is severe and frequently life-threatening. T. pallidum bacteria can transfer from a pregnant woman to fetus through the placenta and during the birth process. Data suggest that without screening and treatment, about 70% of women with syphilis will have an adverse outcome in pregnancy. Adverse outcomes include early fetal or neonatal death, preterm birth or low birth weight, and infection in infants. Symptoms in newborns include saddle nose, in which the bridge of the nose is missing, fever, difficulty gaining weight, a rash of the genitals, anus, and mouth, small blisters on the hands and feet that change to a copper-colored rash, which may be bumpy or flat and spread to the face, watery nasal fluid. Older infants and young children may experience Hutchinson teeth or abnormal peg-shaped teeth, bone pain, vision loss, hearing loss, joint swelling, severed shins, a bone problem in the lower legs, scarring of the skin around the genitals, anus, and mouth, grey patches around the outer vagina and anus. In 2015, the World Health Organization confirmed Cuba as the first country in the world to have entirely eradicated congenital syphilis. Is it curable? Anyone who is worried that they might have syphilis or another sexually transmitted infection or STI should speak to a doctor as soon as possible, as prompt treatment can cure it. Early treatment with penicillin is important, as the disease can lead to life-threatening consequences in the long term. At a later stage, syphilis remains curable. However, a person may require a longer course of penicillin. If nerve or organ damage occurs during the later stages of syphilis, treatment will not repair it. Treatment can, however, prevent further damage by clearing the bacteria from a person's body. When is it safe to have sex? People with syphilis must avoid sexual contact until they have completed all treatment and received blood test results confirming that the disease has resolved. It may take several months for blood tests to show that syphilis has reduced to an appropriate level. Low enough levels confirm adequate treatment. Risk factors. Sexually active people are at risk of contracting syphilis. Those most at risk include people who have unprotected sex, men who have sex with men, people living with HIV, individuals with more than one sexual partner. Syphilitic sores also increase the risk of contracting HIV. Prevention. Preventive measures to decrease the risk of syphilis include abstaining from sex, maintaining long-term mutual monogamy with a partner who does not have syphilis, Using a condom, although this only protect against genital sores and not those that develop elsewhere on the body. Using a dental dam or plastic square during oral sex, avoiding sharing sex toys, refraining from alcohol and drugs that could potentially lead to unsafe sexual practices. Having syphilis once does not mean that a person has protection from it going forward. Even after treatment has successfully removed syphilis from a person's body, it is possible for them to contract it again.